Hi everyone, thank you for joining us today for the AHIF Caregiver Support Group. Today we are going to talk about home safety.
Hello, my name is Anna Page. My favorite candy bar is Snickers.
Hi, my name is Asia, and my favorite candy bar is Hershey.
Hi, my name is Casey, and my favorite candy bar is the Reese's.
Hi, I'm Conley, and my favorite candy bar is Heath Bars.
I'm Haley, and my favorite candy bar is a Kit Kat.
So we're going to first talk about some common home safety topics and concerns. So some concerns that people have is clumsiness, dropping things, or that just things around your house, falling or tripping, particularly downstairs or upstairs. So some techniques to make your home safe for your loved one is no throw rugs. The corners fold and make it hard to, or make it easy to trip. You can do non-stick treads on stairs, and you can have higher level toilet seats. Just depends on height as well. And how to make your home an easier, safe place for your loved one to navigate is something we're going to talk about today. And first, I want you guys to reflect. I'm going to give you 1 moment to pause the video and think about what emotions arise when you're thinking about home safety.
The next thing that we want you to pause and reflect on is how you can apply any of the adaptive devices that you talked about in the previous weeks to help with your loved one with home safety.
Okay, fall prevention is an important topic to consider. The most common cause of traumatic brain injury is falls. So today we're going to talk about some preventions that can prevent us from falling, which is home safety. So today I just want you to identify some safety hazards that you see on the left side of the picture, which is on the left side, and I'm gonna give you maybe 5 minutes to just talk amongst yourself about what do you see in the picture that you think that need to be removed or put away. Okay, I see on this slide, I see on the left side, the chair needs to be placed under the desk, and you need to remove the objects from your desk, like the pencil that you see on the left side and paper need to be put away. Also make sure there's no liquid, as in like cups or anything around your desk so you won't mess up your electronics. And you wanna make sure that the floor is clean. Make sure that you have your shoes put away and books are put away as well. You also wanna make sure that your bed is clean and neat, so that way you won't trip on the covers as they fall on the bed. And you want to make sure everything is clean and neat and tidy for home safety.
Okay, so the activity that we're going to be doing today is creating a safety checklist. This can be used for the people in your household to make sure that everything is safe and you can cross off the items as you complete them. So we're going to give you about 10 minutes and you can pause to do this activity. And we want you to write down what you believe will be helpful for a safety checklist for any of the following rooms. These rooms can include the bedroom and living room, the bathroom, or the kitchen, or any other room that you feel needs a safety checklist. We're going to give you examples after this slide if you need any help, or you can just pause and then come back and look at our examples when you're finished. We'd like for you to try to incorporate the knowledge that you've learned from the past couple of weeks into this activity. And then once you're finished with the activity, we'll allow for everyone to share.
This is an example of a safety checklist for stairs. So the first couple of things you really want to notice in any environment is if there are any obstacles in the way, especially when you're going up and down the stairs, you may not always be able to see the objects. So common things found on stairs, usually like books, papers, shoes. And then also you want to make sure that the space is very well lit. And this example has gray carpet, which can be really troublesome because the whole thing is covered in the same color. So just making sure you have a really well lit path. And then also just making sure that the equipment you're using, like the stairs, is always up to par so far as safety, and making sure that nothing is damaged along the way. So this is just an example to kind of look at and do in all of your other spaces and environment.
Okay, so this is the safety checklist we came up with for the bedroom or the living room. And some examples that we came up with were, instead of having rolling chairs, you can have stationary chairs. You can move.
Hi everyone, thank you for joining us today for the AHIF Caregiver Support Group. Today we are going to talk about home safety.
Rather than just sitting on top of the desk. Make sure you arrange your furniture so there's a path of least resistance, just making things easier to navigate around. Make sure you move all breakable items out of the way, and again, just make sure your throw rugs are put away or you don't have them so your loved one does not trip over them. Okay, so we're also going to go over the bathroom checklist, and you're going to you can clearly label all medications. You can consider having a pill organizer. Move all potential harmful medications out of reach, so there's just no way you can mix up any medications that your loved one might take with something that might be harmful to them. You can install grab bars, bath mats, and safety rails if that would help your loved one, and keep your bathroom clean. Wipe up anything that could be something that would help or make your loved one slip or anything like that. But all of these are just suggestions. If they wouldn't help and they'd just be more harm than good, or they just be more of a stressor, then absolutely don't do that.
Okay, next we're going to discuss the kitchen. And some examples that we came up with were appropriately labeling your kitchen appliances, placing visual reminders by the appliances for the on and off switches, checking with loved ones to make sure that they can reach everything that is in the kitchen. And if they can't, maybe placing them somewhere lower or somewhere that is within reach for them. Keeping a list of food allergies on the fridge just to remind your loved one or anyone else that might be doing any care or anything of that manner, so that they are aware of those. And making sure that sharp objects are placed with the handle up to avoid any accidents that might happen within the kitchen.
If you're with a group, you can take a moment now to just pause the video and kind of discuss things that you found particularly important, or things that maybe others have ideas about that might surprise you. But we'll just go ahead and kind of wrap this up. So safety checklists obviously are not always foolproof, but it's a good starting point, especially just to add like those extra precautions. Two really main focus areas are the kitchen and bathroom. Accidents usually happen there the most, according to the Shepherd Center in Atlanta. And so if you feel overwhelmed by trying to make a safety checklist for the whole house, you might just want to focus on those two areas first, and then just build off of things from there. And obviously we're here from UAB, and we don't know the personal experience that you have with the one that you're caring for or your loved one. So these are all just suggestions, but we hope that like this just gives you a starting point, and that you're able to expand based on the personal needs that you'll have in your space. So thank you just for this, and this is just kind of a way to just get a starting point.